Welcome back to Renergy. This is Dr. Carolyn Bowers, your doctor of physical therapy. Well, let's jump right in. What we're going to discuss today is key to having the best outcome when using Renergy, and really when using any technique in rehab, but in particular when you're using Renergy, which is the blending of rehab and energy work. So let me start off with a definition that comes from the Oxford Languages Dictionary. Intuition, the ability to understand something immediately without the need for conscious reasoning, or a thing that one knows or considers likely from instinctive feeling rather than conscious reasoning. Now, I understand because we're in such a Newtonian phase of medicine, it is very difficult sometimes as therapists that have come through the schools and with the extra emphasis that we've placed on qualitative research, experiments, survey research, all of the different types of research that we're required to do, peer-reviewed articles, that when you start talking about intuition, it makes you kind of go, "Ooh, wait a minute, is this something that's really tested and can be trusted?" And I'll tell you one thing. Once you have developed your abilities to use your intuitive skills, you will change the way you practice, as well as you will change and improve the outcomes of your patients. Let me share with you an example. I was in the hospital. I had a patient that I needed to go see. I had never seen this patient before. It was a female, older female. And I went into the room. I remember actually before going into the room, I had reviewed her chart. And some of the things within her chart appeared that she had not been able to do a lot, that she had not been willing to do a lot, that she had a lot of pain, she had a lot of discomfort, and it was very difficult for her to move. I enter into her room and I introduce myself, and she looks at me and I tell her I am her doctor of physical therapy and I'm there to help observe and see how we can support her. And she looks at me, and as soon as she hears the words physical therapy, she immediately begins to say, "Oh, I am just so tired. I can't, and I just really don't. I've hurt so much when I move." So as I allowed her to share her feelings, I then waited. And then when she paused, I let her know that I understood what she was saying, and she had every right to have that opinion about how she felt doing physical therapy would be too much for her. But in that moment, I'm always speaking to myself, and I'm trying to find out, how can I support this patient where she is? So I began to ask questions to find out what is the hardest thing for her to do. And she began to share with me how every time she tries to move, she becomes nauseous, or she has a lot of pain when she tries to move that one extremity where she has had a injury to. Fortunately for us, this patient is able to weight bear as tolerated. So that's one less thing that we're dealing with her extremities. But we continued to talk, and I continued to allow her to talk. She began to go on about how often she had reached out to staff and they were slow to respond. No one would help, that they left her there for hours and no one came back, and she couldn't get herself up. So her whole thought process at this point is, I'm going to come in, I'm going to get her out of bed or make her move what she doesn't want to move, and I'm going to put her in the chair and I'm going to leave her. And I'm going to walk out, and she's going to be miserable because she's remembering that she was no longer able to get out of the chair on her own. So here's the time where your intuition really comes to your aid and helps you to support your patient. At this point, I realized this patient is very closed, and there are reasons that she is closed. And what I mean by closed is every day when we're dealing with people, when we're dealing with our patients, literally we're facing them, and I'm talking to her or him and they're talking to me. The nurses are coming in and talking to them and they're having to talk back. Doctors are coming in, and everything is face to face to face to face to face. That is where we are always giving. So I, as a therapist, I'm always giving to the patient then is giving back to me. And what happens is, because our patients have a tendency in a lot of situations when they're not mobilizing, is to lay in their beds with their backs against their beds. And what this represents is that they have become very closed because their backs are not open. And so one of the things that I do for my patients, either at the beginning, but most times it's in the middle or towards the end when I finish mobilizing them, is I will help to open up their back. Because once I open up that back, it's amazing. I guess the example would be if someone gave you a nice back rub. You feel so much better. You feel so much more relaxed. But for me, when I do that, it is because I am intending at this point to open their back up so that they can feel the support of those around them, so that they can feel the love of those around them, and that they can also be more open to the information that is coming to them so that they will be more balanced in their response to them. So intuition is key to understanding that, because if I come in there and I continue to just give, and not consider, is it possible that she is very closed right now because she's been laying on her back and she has not been able to receive or feel loved or feel supported? So if I do not address opening up her back, then what I will be doing with her would be a waste of time for her, because she is not open enough to receive. And so the trauma that she had gone through prior by not feeling supported had caused her to close even more. So I continue to work with her. I have very unique and very specific steps in which I work with my patients. And I have told you all that I'm a certified biofield tuner, and I do use tuning forks to help reset that nervous system. And one of the things that I'm going to talk to you about is how I use the tuning forks to activate that vagal nerve. But let's go back and finish with our patient. She then agrees because we've had this conversation and I've talked to her and I've allowed her to share with me what she's feeling. And then I was able to show her how I was going to support her and let her know that pain is no longer an option. When we mobilize, we're not there to increase pain. That is not our goal or our intent. So as I'm listening to her and she's listening to me, I am gaining her trust. She's more open. She asks, hey, can I get up and get onto the bedside commode first? I said, absolutely. Let's do some things so that you can be successful at that. So I began some of the things I've talked to you about. I initiated the reverse count with her, and that was huge because it put her in control of her movement. And this is a woman that showed in her history and based on her prior notes that every time she would move or even put weight on her leg, she would scream with pain. Everything was a scream. So we absolutely began to move through using those different techniques in which I use with the reverse count, and then initiating the movement. And when she was able to stand and move over to the bedside commode, then afterwards she requested could she go to the sink because we did need to wash our hands, right? So she then moved to the sink. And then I asked her, how about sitting up for your lunch when it comes in? And she said, yes. So she sat up and she looked at me and she said, oh, this feels wonderful. And she acknowledged. She said, I usually scream when I walk. I didn't scream at all. And now you might ask, well, why didn't she scream at all? Because nothing had changed. Well, the fact was she was now open to receiving support and feeling supported. She felt the love that was coming to her, and she was open to doing more because she had been placed in control of her movement. She was now directing her care. I was there more as an observer and then offering support where I saw she needed support. Sometimes that was verbal support, sometimes that was physical support. But I was always there as an observer and then giving the support she needed to be successful. And she recognized it. And that allowed her to have one of her better sessions that she had ever had without a lot of pain. So intuition is very key when we walk into a room. Go in as an observer and then begin to have conversations that will help you to learn how they need to be supported. All right, guys, it's time for the tea. According to Dr. Ariel Schwartz, a clinical psychologist, by developing an understanding of the workings of your vagus nerve, you may find it possible to work with your nervous system rather than feel trapped when it works against you. I came across an article entitled How to Stimulate Your Vagus Nerve for Better Mental Health. It was adapted in January 21st, 2017 by Jordan Fallis. What exactly is the vagus nerve? In fact, the vagus nerve is the longest nerve in the body. It dances all over the body. It attaches itself to different organs in our body. It actually helps us with the parasympathetic system, which is our rest and digest nervous system. It influences our breathing, our digestive function, and our heart rate, all of which can have a huge impact on your mental health. But as you can see, not only does it have an impact on the mental health, but it has an impact on the physical health, in particular with my patients. And so I actually activate the vagal nerve tone prior to beginning mobility with my patients. And let me explain why. In 2010, researchers discovered a positive feedback loop between high vagal tone, positive emotions, and good physical health. So in other words, the more you increase your vagal tone, the more your physical and mental health will improve, and vice versa. So, according to Dr. Golubik, MD, medical director of the Cleveland Clinic, the vagal response reduces stress. It reduces our heart rate and blood pressure. It changes the function of certain parts of the brain, stimulates digestion, all those things that happen when we are relaxed. And if that's not enough information to show you how important vagal tone is, check this out. There was an interesting study that had shown that vagal tone is passed on from mother to child. Mothers who are depressed, anxious, and angry during their pregnancies have lower vagal activity. And once they give birth to their child, the newborn also has low vagal activity and low dopamine and serotonin levels. That's pretty incredible. So it's most important that we address the vagal nerve tone when we're working with patients. So also remember, one of the things that you should know is that your vagal tone can be measured, and your patients can be measured by tracking certain biological processes, such as the heart rate, the breathing rate, and the heart rate variability. It states that when your heart rate variability is high, your vagal tone is also high, and they are correlated with each other. So that's a great way for you to measure. So if your vagal tone is low, don't worry. I'm going to teach you some steps that you can take to help to raise that vagal tone. Let me share with you some of the things that can help with activating and improving and raising that vagal tone. Deep and slow breathing, which is one in particular that I use a lot. I will start my patients off when I go into the room and introducing myself. I will ask them to take a deep breath in behind the belly button and below. And then I will first initially teach them how to throw their voice and attach it to the wall. So it would sound something like this. They would take a deep breath in and then throw their voice. And I would have them repeat that 3 times. Then another example of something that I've used with my patients as well is where I will use the tuning fork at this point and I will vibrate it. It's a weighted fork. I've used anything from 144 weighted fork to 128 weighted fork. I've used heavier ones, 62 or 52 hertz, any of those. But in particular, I usually will use the 144 or the 128 hertz. And I will strike it on the heel of my hand, and then I will place it on the outside of their ear and allow them to listen. And I'll ask them, can you hear it? And they will say yes, or they will say a little bit. If one ear hears more than the other, it doesn't matter. I still go back and forth 2 to 3 times, striking it and placing it alongside their ear until I know that they're hearing it soundly. Then I will ask them to match it. And what I mean by that is it's like hum that tune. So I ask them to hum it. And then they do, and they hum along with it, and it begins to vibrate deep into the back of their throat, down into the lower part of their throat area and under the sternum, and it continues to grow the more that they do. And that is something that also will enhance the vagal tone, singing, humming, chanting, and even gargling. So for someone who's gargling at home, for yourself even, or your patients, that vibrates in the back of that throat, which will also activate that vagal nerve to increase the vagal tone. Some other things that are used, or meditation is really good for stimulating the vagus nerve and increasing that vagal tone. It says that research shows that meditation increases vagal tone and positive emotions and promotes feelings of goodwill towards yourself. Another study found that meditation reduces the sympathetic fight or flight activity and increases the vagal modulation, which is exactly what we're trying to get our patients out of, is out of fight or flight. We want the nervous system to come and support them. We don't want the nervous system to come and guard them when we're trying to mobilize them. So that's another one that I've been able to use. Now, here's another one that a lot of people don't recognize, but it's exercise. So one of the things that they have found for exercises that are beneficial to stimulate that vagus nerve and to give us that sense of good feeling is there's, of course, lifting of weights 1 to 4 times per week. High intensity interval sprinting, they say, for 1 to 2 times per week. But I adapt that, and I have used the high intensity intervals for my patients, even in the acute care setting. Because there was a research article that I had read and some with older women that they taught them to ride a bike for 8 seconds as fast as they could, stationary bike, 8 seconds as fast as they could, and then to slow it down for 12 seconds. And they would repeat this cycle for approximately 20 minutes. And they found that the same results that you would get from someone in a CrossFit gym that's lifting the weights and doing high interval training, you can get the same results. And so I've kind of modulated that or adapted that or modified that to fit patients within the acute care setting to help them learn how to exercise for as fast as they can. It could be heel pumps. It could be knee raises. It could be elbow flexion. Any of those. It could be knee abduction, adduction. It could be squeezing the glutes as fast as they can for 8 seconds and then slowing it down for 12 seconds or resting for 12 and then repeating that for whatever length of time. I usually don't have 20 minutes in an acute care setting, but it helps to activate that, and they get a very good workout in a very short period of time, even if it's for 3 minutes or 2 minutes. You should try it. It really does benefit your patients. And here it is saying that it helps to activate that vagal nerve, which helps you to increase your vagal tone. And then, of course, getting our patients up to walk or just walking on a daily basis. So that should be something that we should be encouraging our patients to do, to walk as much as they can. Ideally, you want to walk 30 to 60 minutes every day, but in the acute care setting, that's a little bit difficult to do. But the more often they're able to mobilize and walk with PTs and OTs and maybe exercise physiologists that are now being found in the acute care hospital as well, this is a good thing for them. Then there's also the massage. The vagus nerve can be stimulated by massaging specific areas of the body, in particular foot massages. So how many of our patients are sitting in beds in an acute care hospital and you have the opportunity, you got to put socks on them anyway or put their little footies on with the rubber soles. So you can actually use that time to help to increase their vagal modulation and heart rate variability and decrease them out of fight or flight long before you ever move them. So that's one way that you can start it. Another one is massaging along the carotid sinus area, an area located near the right side of the throat. So you can stimulate the vagus nerve to reduce seizures as well. I mean, this thing is incredible, the things that we can do to influence the vagal nerve. And one of my favorites, and this is where my patients and I really start to enjoy each other, is socializing and laughing. If you can get your patient to laugh, and you will reduce their body's main stress hormone. And researchers have discovered that reflecting on positive social connections will improve the vagal tone and increase positive emotions as well. That laughter has been shown to increase the heart rate variability and improve mood. And the vagus nerve stimulation often leads to laughter as a side effect, suggestions that they are connected and influence one another. So listen, one of the things that I do in particular, and this is why my patients and I have such a good time with each other, is because we are activating that vagal nerve and we're bringing it back into balance. And when we bring that back into balance, your patients will be putty in your hands. They will move in ways that they didn't know they would move. And you will hear the same responses that I hear. I feel so good. Thank you so much. They are so grateful because it's a feeling that many have not felt for quite some time because they've been in pain or discomfort and they've been in a state of frozenness or fight or flight for so long. They have forgotten what it feels like to be free and to be relaxed and to be in harmony again with their body. So don't forget, use that vagal nerve activation techniques with the humming, with the breath, in particular, that deep breath behind the belly button and below. And when they take it in, try to encourage them to exhale a little bit longer than their inhale to really help to reset that vagal nerve activation and to increase that vagal tone. Your patients will thank you and you will be grateful that you did it because your patients will show you by how they move. All right, let's move on to our next segment, I See You. I See You, Mark Anthony Gill. Let me tell you why I want to introduce you to Mr. Mark Anthony Gill, an occupational therapist that I have the pleasure to work alongside in the hospital setting, the acute care hospital setting. Mark Anthony, I'm going to call you Mark Anthony, had the opportunity to work with a patient recently. And this patient appeared to not be responding to the treatment approach therapy-wise. He wasn't improving. He was still struggling. He was in the hospital. He was being re-hospitalized, transferred from one hospital to another hospital, and something just wasn't adding up. And our Mark Anthony actually had the intuition to know, based on his experience and just who he is as an occupational therapist, and seeing the duality of his patients, recognizing that something wasn't right. And he began to dig deep, push and advocate for his patient. And by his willingness to trust his own intuition and trust his eyes and what he was seeing, he was able to help this patient to get the care that he needed. He advocated for that patient, just insistently requesting that another test be done for him that no one else seemed to recognize was needed. But he didn't give up. Thankfully, this patient had Mark Anthony in his corner, and Mark Anthony Gill, an occupational therapist, to be applauded for his work, allowed his intuition to lead him and guide him, and his eyes and his experience to support and be there for that patient, even though that patient didn't really know everything Mark Anthony was doing behind the scenes. I had conversations with Mark on Sundays when he was in, and Anthony would be, I see Mark Anthony. We call him, I guess, Anthony at work. But he was willing to talk about what he was seeing and how he was hashing it out, just saying there's something wrong, there's something off, this is something that needs to be addressed. And he did not let it go. So again, we applaud you, Mark Anthony, for being an exceptional occupational therapist and using your intuition to guide you and for you not to doubt yourself. You helped a patient who was in need of help and needed support. So you did what we always need to be thinking, right? As my patient heals, so does the world. And so you helped him. That patient now knows that you supported him and helped him to get the help that he needed. So thank you again, Mark Anthony. for being the OT that you are. We appreciate you. All right, guys, that's a wrap. See you at the next episode.